Assalamu alaikum. I'm Professor Dr. Haider Jawad Mubarak, and I will present to you the lecture 6 in the curriculum of anatomy of the thorax, and it will be about the blood supply to the heart. When you say blood supply means arterial blood supply and venous drainage. In consideration to arterial blood supply, the topic includes the coronary arteries, which are the right and left coronary arteries. Both the right and left coronary arteries, as shown in the figure, originates from the walls of the ascending aorta that are dilated above the aortic semilunar valves. These dilatations in the wall of the ascending aorta above the aortic semilunar valve are called aortic sinuses. And the coronary arteries supplies the heart wall except for the lining epithelium that may extend to about 75 to 100 micron thickness. The lining epithelium of this thickness receives blood supply from the blood which is inside the heart. And because the coronary arteries arise from the wall of the ascending aorta, they are considered as vasa vasorum of ascending aorta. And I think you know from histology that the large vessels contains blood in the wall of them and is called vasa vasorum, and so coronary arteries are considered as vasa vasorum in the wall of the ascending aorta. You will see later on that the right and left coronary arteries anastomose with each other anatomically, but functionally this anastomosis is poor, ineffective, and therefore functionally or physiologically the coronary arteries are considered as end arteries, because any obstruction to these coronary arteries or their branches lead to interruption of blood supply to the region supplied by them, and that produce what's called myocardial infarction. You can imagine that the coronary arteries and their branches are inside the myocardial wall, the heart muscle. And so when the heart muscle contracts during systole, blood could not run or flow into the coronary arteries, and the main blood flow into the coronary arteries occurring during diastole, in which the heart muscles is relaxing. The name coronary that is given to the coronary artery is considered because the right and left coronary arteries are running in a sulcus seen on the external surface of the heart, which is called coronary sulcus. That sulcus lies between the right and left atria and the right and left ventricles, and so it is sometimes called as atrioventricular sulcus, not coronary sulcus. These figures showing the coronary sulcus or the atrioventricular sulcus. For example, here you can see the right anterior coronary sulcus between the right atrium and right ventricle, and this is the left anterior coronary sulcus between the left auricle of left atrium and left ventricle, and posteriorly this is the left posterior coronary sulcus between the left atrium and left ventricle, while that is the right posterior coronary sulcus between the right atrium and the right ventricle. there are also grooves or sulcus between the right and left ventricles. So here on the inferior aspect of the heart, you can see that this is the left ventricle, while this is the right ventricle, and in between them, this region contains a groove, which is called Posterior Interventricular Sulcus. And also here, this is the left ventricle, while that is the right ventricle, and in between them is also an anterior interventricular sulcus. So there is a region which is pointed there called the crux of the heart. This region represents the point of intersection between the posterior interventricular sulcus with the coronary sulcus. And this region, or this point, the crux, derived from the Latin word crus, is considered as the region where the left coronary artery is anastomoting with the right coronary artery at this region or at this point, the crux cordis. The details of the coronary artery includes the following. First, we will start with the anatomy of the right coronary artery. The right coronary artery is larger in size or in caliber compared to the left coronary artery. It's smaller in size compared to the left coronary artery, and I think the figure shows that also. This is the left coronary, which is larger than the right. And the right coronary artery supply the sinoarterial node, which is the node concerning one of the parts of the conductive system of the heart. The right coronary supply the sinoarterial, the SA node, in 65% of population. And also this artery supply the atrioventricular node of the conducting system in 70% of population. And in that case, if the right coronary artery is supplying the AV node, the atrioventricular node, the right coronary artery is called the dominant coronary artery, and it is called the right dominance of the coronary artery. Usually, as the figure shows, that the origin of the right coronary artery is from the wall of the ascending aorta above the anterior semilunar cusp of the aortic semilunar valve. And so it is originating from the anterior aortic sinus. The course of the right coronary artery is as following. After being originating from the anterior aortic sinus, the right coronary artery descends downward and to the right, passing between the auricle of the right atrium and the pulmonary trunk. Then it descends here in the anterior right coronary sulcus, which is between the right atrium and right ventricle, till reaching the corner, the lower border of the heart, at the corner which is between the right border and the inferior border. Beyond this corner, the right coronary artery turns posteriorly to run in the posterior right coronary sulcus, and then finally reaching the crux cordis to anastomose with the circumflex branch of left coronary artery. Branches of the right coronary artery include the following. First, it gives branches to the atrium to the right atrium, which are called anterior atrial branches, and also it gives at the corner between the right border and lower border, it gives a big branch which is called marginal artery. You can imagine that this branch, which is the marginal artery, is one of the many branches supplying the anterior wall of the right ventricle, and they are called anterior ventricular branches. Posteriorly, the right coronary artery gives posterior atrial branches and also posterior ventricular branches, and just before the crux cordis, where there will be anastomosis of the right coronary with the left circumflex coronary artery, just before the crux cordis, the right coronary artery giving a big branch, which is the posterior interventricular artery, running in the posterior interventricular sulcus. This branch is sometimes called posterior descending branch, and it supplies the interventricular septum on the inferior surface of the right and left ventricle, and also it gives supply to the atrioventricular node. Therefore, according to the branches, we can describe the area of distribution of the right coronary artery. You can see the yellow colored region here representing the distribution, the blood supply contributing to the supply of the wall of the heart from the right coronary artery. It includes the right atrium, most of the right ventricle, except the region near the anterior interventricular sulcus. Most of the right ventricle, except part of the right ventricle near the anterior interventricular sulcus. This region is supplied also by the right coronary artery. Also, posteriorly, you can see that the right coronary artery supplies also the left ventricle, adjoining the posterior interventricular sulcus, and also it supplies the posterior 1/3 of the interventricular septum and conductive system of the heart, including sinoatrial node, atrioventricular node, and the right bundle of His, the right atrioventricular bundle of His, but not the left atrioventricular bundle of His. The left coronary artery, which is this one, is a very short artery. It originates from the left posterior aortic sinus, the dilatation in the wall of the ascending aorta, and as we said, it is of larger lumen compared to the right coronary. The left coronary artery is a very short, about 1 to 2 centimeter. It runs between the left auricle and the pulmonary trunk, and then after 1 to 2 centimeters it soon divides into two major branches. One of them is the anterior interventricular artery running in the anterior interventricular sulcus, which is sometimes called anterior descending branch, and the other is the left circumflex coronary artery that runs in the first in the anterior left coronary sulcus and then in the posterior left coronary sulcus, after which it reaches the crux cordis to anastomose with the termination of the right coronary artery. You can see that the anterior interventricular branch of left coronary, as it descends in the anterior interventricular sulcus, and sometimes it's called the left anterior descending, then it will anastomose at the inferior surface of the heart with the posterior interventricular branch of right coronary artery at the posterior interventricular sulcus. Branches of the left coronary artery includes branches to the left ventricle, except the part near the posterior interventricular sulcus, which is supplied by the right coronary artery, and also it supplies the right ventricle adjacent the anterior interventricular sulcus. Also it supplies the anterior two-thirds of the interventricular septum. All these are supplied by the anterior interventricular branch, which is the left anterior descending, while the circumflex coronary branch that anastomoses with the right coronary at the crux cordis gives left marginal artery ventricular branches to the left atrium, and branches to sinoatrial node in 30% of population. And therefore, according to the branches of the anterior interventricular branch and the circumflex branch, the area of distribution of the left coronary artery is to the left atrium, most of the left ventricle except the posterior region near the posterior interventricular sulcus, and part of the right ventricle near the anterior interventricular sulcus. Also it supplies the anterior two-thirds of the interventricular septum, supplies the left bundle of His, the atrioventricular left bundle of His, and this figure shows the distribution of the blood supply of the coronary arteries, including their branches and distribution. The term dominance of the coronary artery is referred to arterial supply to the interventricular septum. Any of the right or left coronary artery, if one of them supply the posterior third of the interventricular septum, then it is considered as a dominant artery. And therefore, as we said before a while, in 70% of population, the posterior one-third of the interventricular septum is from the right coronary artery, and the remaining percent includes 20% supply of the population. The posterior one-third is supplied by both right and left coronary arteries, and in 10% it is supplied from the circumflex coronary artery, and in that case it's called left dominance. In consideration to venous drainage of the heart, the main vein of the heart is the coronary sinus, which is seen in the posterior coronary sulcus. I think this figure is more clear for the coronary sinus. You can see it is a big vein running in the posterior left coronary sulcus. This is the major vein of the heart. But in addition to the coronary sinus, there are many veins that are called anterior cardiac veins, and these anterior cardiac veins drain directly into the right atrium. In addition to that, we have pits or small veins that are seen from inside of the heart, mainly in the right atrium and right ventricle, that are called venae cordis minimi. So the heart venous drainage is via coronary sinus, number one, anterior cardiac veins, number two, and small pits from inside, seen from inside in between the pectinate muscles and the drapiculi carini in the atria and the ventricles, mostly in the right atrium and the right ventricle. These pits are called venae cordis minimi. Starting with the coronary sinus, which is this one in the figure, we have to say that the coronary sinus is a large vein, about 2 to 3 centimeter in length. It lies in the left posterior coronary sulcus. It is open directly into the right atrium, and I think you have seen the opening of the coronary sinus, which is guarded by valve. This large vein, the coronary sinus, receives many tributaries, including number one, the great cardiac vein, which runs in the anterior interventricular sulcus with the anterior interventricular artery. This is the first tributary of the coronary sulcus. It begins at the sinus. It begins at the apex of the heart and ascending in the anterior interventricular sulcus, and then reaching the left side of the coronary sinus. The other tributary for the coronary sinus is the small cardiac vein, which is this one. It runs with the marginal branch of the right coronary artery. This is the marginal branch of right coronary artery. You can see that the small cardiac vein runs with it, and it ends by connecting to the right side of the coronary sinus in the right posterior coronary sulcus. And the third tributary, in addition to the great and the small cardiac vein, is the middle cardiac vein that is seen in the posterior interventricular sulcus together with the posterior interventricular artery branch of the right coronary artery, ending into about the middle of the coronary sinus. In addition to these three major tributaries, we have a small tributary which is called posterior vein of left ventricle, which is this one. This is a minor tributary, and a small vein also which is called oblique vein of Marshall, draining the left atrium and running on the back of the left atrium. So this is the first topic of the venous drainage of the heart, which is the great coronary sinus, the biggest vein of the heart. The other veins of the heart are, number two, the anterior cardiac veins. These veins drains the anterior wall of the right ventricle, and usually there are more than one, about 2 to 3 in number, running parallel to each other, and they are open directly into the right atrium. And this is also a diagrammatic representation for the veins of the heart, and this is also another representation, and that's also another representation. Finally, number 3, in addition to the coronary sinus, the anterior cardiac vein, number 3 are venae cordis minimi, and we said that these are just like pits. These are the pits that are called venae cordis minimi, small pits seen from inside of the walls of the heart near the trabeculocarinae and pectinate muscles, and they are numerous actually, seen mostly in the right atrium and right ventricle, but also these venae cordis minimi could be seen in other parts, but their major accumulation is in the right atrium and right ventricle. Thank you very much.